All right. All right. Let's see here. Shelly, did you just let somebody in? That's so great. I appreciate it. I get so distracted with those. Okay, so let's go ahead and get started. Good morning, Washington State peer support people. So glad that you're here with us at the monthly blend. So just to let you know, we are well over 6,000 individuals who are currently certified in Washington State, as well as trained, and we are just choo-chooing forward on this express. We have about 44 more trainings until the end of June currently right now, which is amazing. And so we're making some pretty fantastic strides moving forward. If you haven't had an opportunity yet, please take a look at the peer blend, or excuse me, the peer-to-peer newsletter. See, I got distracted. And so if you need a link to that, let me know. If you are not part of the listserv, let me know. We'll make sure that your new email or old email gets added in. And so today we're going to be introducing Dad's Move. If you don't know who they are, they're pretty darn fantastic, and really have a wonderful viewpoint on how to help parents, specifically fathers, single fathers, help their children with behavioral health struggles and navigate a really complicated system. So, but before that, I want to say, please, Shelly, go ahead and make your announcement, and then we'll just go from there.
Hi, everyone. Good morning. Just wanted to plug in the next webinar for operationalizing peer support on the 17th of January from 9 to 10. Wanted to let you know I'm going to host Rita Cronise, which is one of the creators of the National Practice Guidelines for peers and supervisors. And you're all welcome to join. I'll put the link in the chat, and I will let you all go on with your webinar. Thank you. Have a good morning.
Thanks, Shelly. Okay, Nelson, well, please take it away. I will make you a co-host so that you can share your screen. And we're all really looking forward to what you have to say today.
All right, let me see if I can get this going.
No problem. Hey, Nelson, do you want to answer questions in the middle of your presentation, or would you like to wait till the end?
Till the end.
Okay, sounds great.
If my mouse will work. Can you see my screen?
Yes. There we go. Perfect.
Well, maybe.
No worries.
There we go.
Perfect. All right. Take her
All
away.
right. So I wanted to just do an introduction to our group, and also talk a little bit about projects that we have going on. Although there's actually a couple things that I forgot to put on here that I'll talk about at the end. So I'm Nelson Rascone. I'm one of the founders and the executive director of Dad's Move. A little bit about myself. I am the father of 3 grown children, 2 stepchildren, 1 biological child that my wife and I raise together. All of my children have behavioral or developmental needs, so raising them was quite taxing on us. So between the 3 of us, we probably accessed every single system in the state of Washington, which is how I got here. I kind of wanted to take my lived experience of banging my head against the wall trying to get services to try and make the road a little less bumpy for everyone else. So that's kind of a little bit about me. And let's see if this will work. I am going to stop screen share because I think my screen got, yeah. Apologize about that. Can you guys still see my screen?
Yes, and it's not on presenter mode anymore.
That
It looks
well,
great.
I have 3 monitors. So
I
I
understand.
shared the wrong one. All right, so that's a little bit about me. So, you know, our mission is simple. We want to strengthen the father's role in raising children with behavioral health needs. And we're a big believer in education, peer support, and advocacy. You know, we simply want to see more father involvement in families' lives. So a little bit about what makes us different, because what a lot of people don't realize is we actually do work with moms. Probably about half the parents we've worked with have been moms. We simply have a focus on fathers, and we were started by a bunch of fathers. So at some point, all of us have been parents of children with special needs, in particular, ones with challenging behaviors. And all of us that started this group lived it 24/7. We're dealing with all of the challenges that goes along with that. And, you know, another thing that of course makes us different is that our staff is predominantly male, not completely. We do have some females on staff, and actually have a new couple of new female staff members coming on board here shortly. We try to educate fathers on the complete system of navigating, you know, wraparound IEPs, and we want to bring that male perspective into the various systems. One of our core beliefs that drives everything we do is we believe in fathers being fully involved in their child's life. I'll actually share a few statistics here in a second, but for far too long, men have been, quite frankly, either completely absent, or moms have shouldered the load raising the children. And this is particularly difficult if you have a child with special needs and challenging behaviors. It's very taxing on you if you're having to do it by yourself. So a little history about us. This picture was actually taken at our very first retreat in 2013. One of the things we're very proud of is we're very grassroots. We were not started by any government initiative, no government money. It was just a vision of 6 fathers, and we all pooled our money together to file the necessary paperwork. And this retreat that you're looking at was actually paid for out of our own pocket. So we were very dedicated to what we believed in, and that is what's propelled us. As I was mentioning earlier, we do serve moms. We're not just for dads. I also want to bust a few other thoughts. A lot of people think we work with single fathers. We do, but not exclusively. Most of the fathers we've actually worked with have been, they're in the home with their partner, but they're disengaged and not an equal participant in raising the child. That's probably been about 80% of the clientele we serve. Interestingly enough, to show the value of moms, probably a good chunk of the men who have come to our Father's weekends were kind of nudged there by their partner. So we owe a lot to the moms out there. So now I'm gonna just show to illustrate some statistics, and these are actually fairly recent statistics we pulled up for some grants we wrote, just to illustrate fathers matter, and they matter a lot to a child's development. And it actually, a lack of father involvement is very intertwined with a lot of the challenges we have in our system. So I won't read over all of these, but as I said, most of these statistics are within the last 5 years. So like 90% of all homeless and runaway children are from fatherless homes. 71% of high school dropouts are from fatherless homes. And 63% of youth suicides are from fatherless homes. So again, it's very intertwined with a lot of the challenges we have in society. So we really try to drive this home. Father support isn't just a nice thing, it's essential to overcoming a lot of our challenges in society. At the core of what we do with everything is we want to empower fathers. We often will use the phrase that it takes a village to raise a child, and that village needs to include the father. And for far too long, fathers have been kind of an afterthought, which I will admit is kind of our fault for a long time, but that needs to change. Aside from that, we also are big into destigmatizing mental health. I will freely admit, a lot of times when you get a child that gets a diagnosis, men often have a harder time accepting that than moms do. And a lot of that has to do with the way we're wired. Men are very much wired to be fix-it people. And a lot of us have a hard time wrapping our head around, well, we can't just fix this. So we work with a lot of men to kind of get them to get over that and accept their child for who they are, and that it's not the end of the world. It just is a different vision than you thought. We also want and encourage men that they need to be equally involved. We're about kind of equality, and that men need to fully be involved with raising the child. So I'll tell you, having raised 3 children with difficult behaviors, my wife and I probably wouldn't still be married if both of us hadn't equally contributed to going to the IEP meetings, the therapy appointments, the counseling appointments, dealing with 911, unfortunately. We just wouldn't have survived. So this is kind of the message that we send guys that come to our events. So in everything we do, we really try to create a welcoming environment for men, because a lot of times they're nervous. As I said before, many were nudged or outright pushed in some cases to come to weekends or trainings. And so they're very hesitant, nervous, or just flat out don't want to be there. So we really try to create a welcoming environment and even create opportunities for guys to get involved. We, quite frankly, couldn't do this work without our various community partners across the state and even beyond. We work with other groups in other states, and we're constantly looking for training opportunities to further educate our staff. I always look for those free trainings or low-cost things that our members can get involved in. So now I'm going to talk a little bit about our current and ongoing projects. It's been 2022 was quite a busy year. Probably about 80% of what we do is training. That is at the core of what founded the group. So we're constantly looking for new trainings to either develop ourselves or to get certified in. And we've also created an online training platform, which I'll talk more about in a minute. So people can take certain trainings on demand at the comfort of their own home. We have put together our own father-to-father peer training that is also accessed through our learning management system, so people can take it at home. This is not intended to be in place of the state training. It's intended to be for fathers to give them even more education to hopefully get more working in the field. We have a new program in Pierce County, the Fathers and Families Crisis Support. We have a new contract with King County that is allowing us to hire some peers, which we have a couple of them on the line right now. And then last year, we were the recipient of the SAMHSA Statewide Family Network Grant, which we actually wrote to complement the King and Pierce, which was a risky thing because you never know if you're going to get it or not. Luckily, we got all of them. We have also been contracted with DDA for about 2.5 years now to be a community engagement contractor. We currently have 5 people working under that contract. And then we are continuing to fundraise to try and build an equestrian and training center out in Eastern Washington, which has been a funding challenge, but we hope to have an update on that sometime this year. And then we've been having ongoing conversations with the DOC to try and do some education for fathers coming out of incarceration. Let's see here. So a little bit more about our training and online platform. We were able to build the learning management system in partnership with Beacon Health, which right now we have 2 trainings on there, plus the peer. Under this program, we are also able to do several mental health first aid classes for Pierce, Southwest, and North Central. We actually have 2 classes left under that contract to do, so stay tuned for that. And we're currently waiting on a proposal to them that would allow us to actually get to do a train the trainer class, so we can increase the staff on board that's certified to teach mental health first aid. So also in partnership with Beacon, we developed our 30-hour father-focused peer training, and again, this is online, where people can take it at home. And we are actually currently still adding to that program. So it's probably gonna expand a little bit more this year. And we're probably gonna teach it in person with some of the modules being done at home. So also working with Beacon, we have hired 2 peers for Pierce County who are both fathers, and the intent is to work with fathers that have children in various systems in the county, to try and work with them on understanding the system, getting more involved, and getting them education and potentially for those that are interested, provide them the support to eventually, hopefully work as father peers in our systems in Pierce County. And kind of off of using Pierce County as a model, we have a contract with King County also to expand father peer support in all of King County. We have actually 2 contracts with them. One is for kind of the urban area and one is for the rural area. We currently have a full-time and a part-time peer who are, I believe, on the line right now, working, that just started to work with this contract, and they are ready to take referrals to work with families that are involved in various systems in King County. I will also add, we are, if any of you know anyone, we're still hiring for 2 positions to focus on the rural part of King County. So we're looking forward to filling that out and providing supports to families across King County. So our contract with DDA, as I was mentioning, is for community engagement. And what community engagement is we take young adults who have certain cognitive or behavioral challenges and get them involved in the community. We currently have staff in King and Pierce County. However, we're looking to grow beyond that because it is a state contract. And we also just got a grant from what's called the Dan Thompson Memorial Fund that is paying for activities. So we're now able to take these clients to the zoo, take them bowling, take them to various activities to get them engaged in the system. So again, if anyone knows anyone who's interested, let me know. We're looking to grow beyond the 2 counties. So our SAMHSA grant again was written off kind of to complement our work in King and Pierce County. And under this grant, we're hiring 2.5 peers. We're still looking for a part-time one for Okanagan County. And we're also, well, I shouldn't say this, we probably have them, but we also want to put a peer in Grays Harbor County. So this contract is really focused on serving underserved parts of the state for peer support and training, and to get more parents involved in different support services. And last but not least, this is again ongoing contract negotiations with DOC. And what we're hoping to do is to start working in the prison system to work with fathers that are coming out of incarceration. So the idea is that we would start working with them probably about 3 months before release, and then work with them after they get out. Again, with the goal of 1, potentially giving them employment opportunities by maybe getting some of them to work as peer supports. Number 2, and most importantly, is more successfully transitioning them back into their child, family, and community's lives. This is a huge problem. There's just not enough support to support people coming out. And we all know the challenges that results from that. So, and to kind of go along with that, we're exploring ideas of doing a housing program that again, these fathers can transition to, where they get support, training, and life skills, and just to better transition them back into the community. So one last one that I will mention that I forgot to put on here because it's new is we have signed a contract with Division of Child Support that will actually, it's a pretty cool program. It's actually designed to provide education and support to at-risk young men in hopes of them not becoming a father until they're better equipped and ready in life to do so. It's a pilot project, and we're one of 3 organizations that's gotten contracted to start doing those trainings. And we're probably going to be doing them at first in Pierce and Yakima. So with that, I will open it up for questions.
Thanks, Nelson. Does anybody have questions that they'd like to ask Nelson about the, Dad's Move and all the wonderful things that they're doing to help our community? You're welcome to pull yourself off of mute and or type it in the chat box, whatever you feel the most comfortable doing. Nelson, you said that you had a couple of peers on the line. Would it be okay to ask to introduce them and maybe say hi so we can recognize everybody?
Yes, so I'm first gonna pick on Will. He just started literally this week. He lives in Seattle. You wanna talk a little bit about yourself? I don't want to speak for you.
First of all, good morning, Nelson. How you doing?
Good.
All right. Good morning, everybody else, and thank you for letting me join this group meeting. My name is Will DeRuin. I live in the Seattle area. Nelson brought me on to try to bring some more clients so we can start expanding in Seattle. I have five boys of my own. I was a single father for a very long time, but I got recently married, and so I have a lot of support. I know how it is to raise a child as a single father, and it's not easy being a parent, let alone being a single father who may have somebody who has a behavior problem or any other issues going on in their lives. So I want to come back. I had did this previously before, working as a paraeducator in the school system. So I decided to come back, and as my children all got older, I wanted to come in and get back to my community and do what I was doing before. And I came across Dad's Moves, and it was just like a blessing. So once again, thank you, Nelson, and thank you everybody else. And let me throw that in. Any clients or anybody you guys might want to know who may need some assistance, please send them our way. So I'm gonna send them my pitch line in to you guys right now as I say my goodbye on that one. Thank you for everybody, and I'm glad to be aboard.
Thank you, Will. And then I will introduce Alberto, who is also in, he lives in Shoreline. You want to say a little bit about yourself?
Sure. My name is Alberto. I'm originally from New York City. I moved out here about 11 years ago. I met my ex-wife out here while I was on vacation. We have 5 kids together, 2 girls, 3 boys. 2 of my kids, one has emotional behavioral issues, which is my oldest son. My youngest son was just diagnosed with verbal autism, so he's not really on the spectrum. I came across Dad's Move like around 2011 is when I came across him. I joined him. I believe I joined him in like 2012 or 2013. And then from there, it was kind of on and off, for a couple of years for personal reasons, until this opportunity came up of becoming a part-time peer specialist. And I decided that I want to do this. to give back to to parents, especially for me, it's especially it would be for single moms, only because it's hard for single mothers to raise kids with behavioral issues. Most, I would say, the population, and my personal experience, most of the parents that have children with behavioral issues are gonna actually be single mothers, only because I would say for myself is because fathers can't deal with it. Once they find out that they have a child with a physical or mental disability, they kind of panic. They don't know what to do. So they get scared. They don't know who to turn to. They don't get the support. So for me, it's more of giving back to helping whether the mothers or fathers actually help their child develop correctly and raise them so like that they don't get stigmatized with certain terminology that's used that actually help actually puts the child down, you know. So basically, you know, I'm just here just to help families out as much as I can.
Thank you, Alberto. So now we have two on that are for Pierce County. Brian, would you like to say a little bit about yourself?
Hello, excuse me. Hello, I'm Brian. Sorry about my voice and my throat. I've been at the hospital all night with two of my kids. So, anyway, me and my husband, we never thought we were going to be the dads. We just thought we were going to be like the cool uncles. And then through a series of unfortunate events, we ended up getting a bunch of our nephews and nieces, and we've since adopted them, so they are officially ours. And two of them have special needs. They're in special ed classes, mostly for just because they're super behind on reading and writing and like math and stuff, but they're getting really good about getting caught up to grade level. And one has ADHD and the other one has opposition defiance. That's always fun to put the two of them together. And then that's about it. Started in November with Dad's Move. I'm really enjoying my job. If you're working with one of the agencies in Pierce County, please send referrals to us. We would love to work with more families. And that's about all I have. I don't know. Is there anything else I should say, Nelson?
Whatever you're comfortable with. I just wanted to give you some space to, I don't like speaking for other people.
All right. Thank you.
And then our other Pierce County peer, Joe, I believe is on the line. Would you like to introduce yourself?
Sure. I tend to be the long-winded one, so I will attempt to keep this brief. My name is Joe Saladino. I'm a Washington State born and raised kid, Kitsap County specifically. And my first career was as a marriage and family therapist. Then I became a photographer for a little bit after following my wife and her job out to Minnesota, of all places. And then I was a stay-at-home dad for almost 6 years. And I actually met Nelson at a stay-at-home dad conference that I go to yearly in Phoenix, and had been talking to my friends about how, you know, I loved being a stay-at-home dad. It was a great thing, but I needed to get back to my career and we needed to make money. And for the first time ever at a conference, I believe, I had been talking to Nelson after a presentation, and he said, "Hey, contact us. We'll be hiring soon." And whenever you hear that from somebody, you're certain that it's a blow off. No, within about 3 weeks, I was hired. Maybe it was 4 weeks, but it was really quick. So
Yeah, it's pretty quick.
it was very quick. But so really excited to be doing advocacy work and working with dads. My son was just diagnosed with ASD, And right before I started this job, we had our first really big 15-person IEP meeting at the school. And I had additional support there through a family member, but it kind of put a fire under me to help dads and help parents going through the school systems, because the support isn't always there. And a lot of times you have no idea what's going on. So yeah, so I'm excited to, be working and helping out others again.
Awesome. Thank you. Thank you for that. I did want to add, I will send this to Amanda to send out to the network. We actually have an email we have developed for taking referrals of families you think that would be a good fit for us, along with a referral form and an information sheet. So I will get that out to everybody.
Thanks, Nelson. I appreciate that. You addressed the questions in the chat, I think, right? Do you want to address them out loud just in case people aren't really reading the chat?
Yeah, that would be fine. So, so someone just asked, are the jobs that Dad's Move has posted going to be posted through February? So we have posted them, but I will send again, Amanda, some fresh, job descriptions to send out. And so right now we are still looking to hire a full-time and part-time peer in King County. One in Okanagan and potentially one in Grant and potentially one in Grays Harbor. I say potentially because I think we found our Grays Harbor peer, but we'll see. It's definitely been a learning tool. Hiring people has been more of a challenge than I thought.
Yeah.
Um,
Nelson, are you planning on doing anything in Yakima for?
Yes.
Okay, that's wonderful. It's a big
And
place.
we may, and I can't really talk about this right now because we're still dealing with it. We may be hiring in Southwest.
All right.
Like
I had to do the map in my head.
Yeah. So, but hopefully I could speak to that later on. We'd like to eventually cover the whole state, but money.
One step at a time, right, Nelson?
Exactly. Any other questions from anyone? I'm hoping I'm answering the chat.
I think you're doing great. I think Justin asked if you'll be connecting with Juvenile Parole, JRA, State, and or Parole.
Yes, and I think I might have answered that, or I intended to.
Okay.
We've attempted to. I will tell you, it's been interesting connecting with some systems in the day of COVID and also the holidays, but yeah, we are actively still trying to connect with all of those systems.
Wonderful. Javon has a hand raised.
Yep. Yeah, Javon.
How you doing? Good to see you again, Nelson. And I'm also very proud of your team you're putting together. It's good to see Alberto. He's a good friend of mine. I'm very happy to see what's going on. But my question is, do you all have anyone who works like forensically in the courts with fathers who are working towards family reunification?
Currently, no, but that is something that I definitely wanted to kind of get involved in. So that is something that's on our radar, but as of right now, no. But that's, it kind of, again, goes, I won't bore everyone with stats, but that right there also goes to the heart of a lot of the stats we've pulled up. There needs to be more focus on that. There's just a huge impact on our society from just lack of father involvement. As I often tell people, On the flip side of things, my son's mother disappeared because of her own mental health, and she was not involved with his life. And to this day, he's 26. He has challenges with connecting with women. And a lot of that is traced back to his mother disappearing. Well, the same is true for fathers. So, you know, they're important. And I think we need to put more focus on that.
Thank you for your answer, Nelson. I appreciate that.
But yeah, so again, we're not currently, but we want to. I'd probably say we're willing to work with any system that gets at our core mission of empowering fathers to be more involved, and to be, you know, to be part of their families' lives in whatever system that is. Now, one thing we do not deal with, and I'll mention this, we get the calls all the time, child support or custody related issues. Not that that's not important, that's a rabbit hole. So I will leave that up to other organizations that are better equipped to deal with that. Any other questions, or I'll just put out there if you guys think of any. I'm gonna drop my my email in the chat, so feel free to contact me anytime.
Does anybody
If I
else have anything for Nelson? Any questions or just really great comments or support or anything? Kathleen, yes, please.
So Nelson and team, I was raised by my father as an only child, and I get so excited about like father involvement. And so I'm just so excited that you're all here and introduced yourself, and just to see the kind of impact that you all can have in the state. It's just incredible. So as the daughter of an amazing single father, like bravo. I'm so stoked.
Thank you. Yeah, well, thankfully I wasn't for long, but I was a single father for 3 years until I met my current wife. So luckily I wasn't for too long, because it's a lot of work.
I put my dad through the ringer. I know.
Oh yeah.
I can say, I was a single parent for 10 years of 2 children. And one of them had pretty substantial behavioral health struggles, and it was very difficult. But what I found to be difficult was when I got married, we didn't know how to, like, we didn't know how to do things together that I had already been doing with the kids for so long. And so it took time to make that mesh together as well. And so I think that that's something to be said when you have blended households too, and you have one parent who's been doing the majority of the support for so long, and then you have a new family come together that way. That's you know, I'm glad to hear that you work with families that way as well, because that was a huge challenge and barrier for my family, because I didn't grow up with a father, so I wasn't sure how to make that work with my husband. And so this is really amazing support that you're offering to individuals in Washington State, and I'm really glad to be working with you at DADSBU. So, and like Amy said, pretty fantastic experiences working with DADSBU for the last 4.5 years. So,
Well, thank you. I will throw out one other thing. Just, it's now that we have enough staff to support this, one of the things I want to start doing is actually doing education to private employers. some of you know this, some of you don't. What got me here was I actually used to be a driver for Metro for 8 years. And I was fired for missing too much work because I was constantly having to take my bus back to the yard to deal with my son blowing up in school. And of course, I didn't know about all the stuff I do now. And long story short, when I was fired and talking to my boss, his comment to me was he didn't understand why I was having to deal with this. Where's mom? And I looked at him and I said, I am mom. And he goes, well, this really shouldn't be your problem. So those kind of attitudes are out there and we'd like to change that.
Also, as a side note, I want to just add also, Nelson, you were saying what we do work with dads, but we also, if there is no father in the family, we work with any identified male as who's a father figure in the family. So it could be cousin, uncle, grandfather, long-term boyfriend or whatever of the families as well. So not just like the biological father or a stepfather, any identified male figure in the home. So just wanted to put that out there too.
Thank you, other Nelson. I'm just playing.
Sorry, I just go with the link that he sends me on our calendar. So I'm sorry, I didn't know it has his name attached to it.
No, it's okay. We all had a good laugh about it. We're like, oh, so there's 8 or 9 Nelsons. It's all good.
We really don't need more than one of me. Trust me. That could be scary.
This is Cindy Adams, and I want to say I've known of of you, Nelson, although I've never introduced myself to you, but I've known of you and Dad's Move and for a number of years, and I think it's absolutely wonderful what you have done and where you've brought this group and the people that you've helped. And I think in a lot of aspects, we tend to, and myself included, focus on the mom and the kids and kind of forget about the importance of the dad. And so I really appreciate this and the help and the resources that you can offer someone. And I'll definitely share that your guys' information so other people have an opportunity to join in with you.
Thank you.
I just wanted to add something really quick. I really appreciate hearing about your organization. I think it's amazing. I'd like to hear that you'd like to get into that sector of working with private employment. Kind of along those lines, that was our experience in my family of like culturally the differences, but also because we were a military family, we didn't access all of the same opportunities that I work with so many families the last decade plus accessing. And so that's the struggle of like the not understanding. So very similar to your experience of being told, you got to handle this. This isn't your problem. What are you doing? You got a job to do. It's very much culturally how it is within the military. And then when we were dealing with multiple deployments for lengths of time, we were each alone. I have 5 children too. So thinking about how to navigate when you don't have full access, and then who do you reach out to when you're being met with people culturally, whether it's within your own heritage or family culture. My family culture from long distance was like, the way your child is determines how you are as a parent. And that's a hard thing to overcome, those ideas. And so I just think it's great that you're trying to get into that private area where, it's not just families who are on Medicaid that experience these challenges. Children and families everywhere are going through it. And I just appreciate all of you being here, because I think that's why most of us came back to this work, is in some way our own experience. So just want to say great job.
Thank you.
And Bianca, that's awesome what you said about not erase Medicaid. That's what I really love about here in Pierce County, is with our contract, it allows us to work with Seneca, or the families who don't have the Medicaid. And I think that needs to be included in insurance. I think it's not right that Medicaid patients get, or families get, all these great services, or don't get me wrong, they deserve to have, but so do the families who have just regular insurance. They deserve to have all the same supports that the Medicaid families have. And I really advocate, like, to our legislators, that we need to encourage the insurance companies to put those in their policies so those families have all the same supports as the Medicaid families.
Yeah, absolutely. I mean, I think that's kind of, we experienced going through juvenile systems, through mental health, behavioral health, JRA. So we experienced all those systems, and that's kind of where you started to get help, but it was only after you're already involved for years with a child who's, you know, struggling. And so, and even as a parent, where do you find the support except when it's really bad and suddenly you qualify for something temporarily? But yeah, no, it's very important.
Thank you. I just noticed a comment from Julia to answer your question. We currently do not have anyone in Snohomish County, but again, I'm hoping to change that.
This is really, really great, Nelson. I love that everybody is popping in and asking questions and being involved. This is my favorite part about the blends is people having the opportunity to ask questions about programs they may not know very much about. So does anybody else have any more questions or comments that they'd like to offer up to Nelson and his team?
I have a question. So if you don't have anybody up here in Snohomish County, if I have clients that actually are here in Snohomish County, can I send them to access your services in King County? Do they have to live in the county?
We have other people that can probably support them, particularly definitely virtually. So I would still say send them our way.
Thank you.
It's a great question. Anybody else? We got 4 minutes. Javon.
Javon.
Yeah, y'all act like y'all know me. Nelson, what's going on, my brother? When's y'all next trip? Y'all camping or what'd you just do the last one? You guys went somewhere.
Oh, we were at the Federation of Families Conference.
Yeah. How was that?
Oh, that was excellent. So to answer your question, we are supposed to be presenting at the Families and Fathers Conference that's held every year in Los Angeles in April.
Oh, pretty cool. All right. All right, man. You got my support for whatever you do.
Thank you.
We're also hoping to present at the Washington State Behavioral Health Conference in June. So we're hoping for that in Kennewick. So we're hoping.
Oh, really?
Yeah,
great.
I'm on, my fingers are crossed.
Well, we'll definitely have to have you come and sign up for a workshop at the Peer Pathways Conference too at the end of August. Plug, shameless plug.
Yes, that's actually on my agenda. So
Oh,
yes,
good.
definitely. There's actually a conference I'm looking at that's in Australia that I'm thinking
you
of
in
putting
Australia,
in a
Nelson.
presentation to.
Stuff eats you in Australia. You better be careful.
I actually have relatives there.
Well, I guess if they must know what they're doing.
I don't think a lot of people know this. I have relatives in 14 countries.
Wow.
Yeah.
Are you all travelers? Is that?
You know,
Or is it just like
it's a very long story, but I will say that I come from a background of a lot of mental health challenges in my family. I am well versed. My my mother and her siblings left Germany escaping family problems, and they went all over the world.
All right. That's amazing. I mean, the family problem's not great, but the all over the world play part, that's pretty fantastic. I went to England once. I felt pretty fancy.
Yeah.
Okay, well, it is 9:59. If nobody has any additional questions, I would like one more time to say thank you to Dad's Move, especially everybody who's boots on the ground and out there, you know, doing what we can or what you can to make services a little bit more accessible and understanding. And so thank you again for your presentation. There is a link in the chat box to Shelley's OPS webinar on the 17th, please. If you can attend, it's going to be wonderful. And of course, the first Thursday of every month, you'll have an opportunity to swing by in here and say hello and meet our speakers. And we're really glad that you joined us today. So if there's nothing else, I hope you have a very safe and wonderful weekend, and please take care. Thank you, Washington.
Bye.
Thank you.
Thank you. Bye, everybody.